Program support for Ask a Question, Save a Life comes from the Substance Abuse and Mental Health Services Administration, Garrett Lee Smith Memorial Act.
This program is made possible in part by the Kim Foundation, reminding viewers there is help, there's hope, and there's healing for lives touched by mental illness. Learn more at thekimfoundation.org.
Program support comes from Bryan Mental Health Services, offering hope and treatment for patients with mental health issues and their families. More information can be found at bryanhealth.org or by calling 402-481-5991.
What is depression?
Where do I get help?
Do you know the warning signs?
What should I do?
It's okay to talk about suicide.
Suicide of our military service members is at an all-time high. It is now surpassing the rate of the general population.
Females attempt suicide 3 times more than males.
Most individuals who are suicidal often display cues or warning signs.
Older adults have a rate of suicide 50% higher than that of all other ages.
Ask a question, save a life.
Ask a question, save a life.
Ask a question, save a life.
Hello, I'm Dr. Dave Myers, Bryan Medical Center Mental Health Services Manager and co-chair of the Nebraska State Suicide Prevention Coalition. Suicide is a public health problem that impacts all ages. Suicide is preventable, and by becoming more educated about suicide prevention, the more lives we can save. There is a myth that says if we talk about it, it will give somebody the idea. This is indeed a myth. The best thing we can do is to talk about it, and by raising the question of suicide without shock or disapproval shows the person you're taking them seriously and are responding to their pain. This program is going to focus on suicide prevention in our military population.
My name is Scott Ehler. I'm the full-time state support chaplain for the Nebraska Military Department, and my job in Nebraska is a resource for people that are in need.
I am Roma Amundsen, Brigadier General, retired, United States Army.
I am Sergeant First Class Wilson, and I've had thoughts of suicide.
I am Viola Raschke. I'm the Director of Psychological Health for the Nebraska National Guard.
Upon returning to the U.S., things were different. I was different. I felt out of place and angry all the time over little things.
Well, since I have young children, it was hard for me to put on my mommy face and be the perfect mother when all I was thinking about was my time in theater. My husband and I started fighting daily about my drinking at night and my depression that seemed to consume me. I went to see my doctor and he put me on a medication, but I couldn't stop drinking, and my depression just seemed to get worse with time.
I think military members are more susceptible to suicide with basically what everybody else is susceptible to suicide with. The factors that we see are mostly financial and relationship factors.
In a 6-year period of time, for an active duty family, there are more stressors placed upon a military family than in 80 years of a regular family. So indeed, there are more stressors, but on the other hand, the military has been reacting to counteract some of those stressors. They've become more aware of it, and so I think that that's helpful.
When I was going through reintegration, bought a motorcycle, and I began to drink heavily due to being alone at night. I didn't want to go back to that dark place.
The biggest thing that family and friends need to look for is When we see these stressors like financial and relationship, when they start to pile up on each other, because I think those are probably the two biggest foundational issues. And then we start adding in different things like alcohol abuse, substance abuse, we see depression. These are the things I think fan the flames. So I think families and friends, when they look towards to that, when they see stuff just start all these different stresses piling on top of each other, and a person doesn't know where to turn, doesn't see any hope, once those things start to pop up in people's lives, that's when we need to really stand up and take notice.
My family didn't understand what I went through, and I couldn't tell them.
Well, my family was exactly the way I left them, but I was different. They expected me to just jump back into this mothering role when, after a year or so, that part of me had just been turned off. It was hard for me to adjust back into carpooling and soccer games when all I really wanted was to be back in Iraq.
Things that family members and friends should look for in terms of identifying stressors. It could be the increased use of alcohol and drugs. It could be withdrawal from normal activities. It could be just simply staying by themselves, withdrawal from all activities whatsoever. It could be sudden changes in demeanor, depression. These would be some of the things I think that you could probably identify.
Family members and friends are the first people that they're going to spend the most time with individuals, and they're the first ones that are going to see some very minute change in behaviors. There seems to be a thing within our society that people don't want to ask, have you thought about suicide? Have you thought about hurting yourself? Because there's an idea that if I ask, suddenly that becomes an option or that becomes an idea, which is completely not true.
There's a lot of resources that are out there. I think probably the easiest to turn to are the chaplains and the director of psychological health in the state. We'll be able to point them in the direction that they need to go, give them the help that they need. Especially with family members, we'll be able to give them, some things some questions to ask their family members. Really kind of just look into what's going on in their lives to see if they are at risk.
The Nebraska National Guard has what we call a peer-to-peer program. So there's individuals within each unit that has specialized training in how to help each other with emotional as well as any financial, any stressors that occur. They're specially trained to help with that. So any trusted friend, family, anyone within their unit, the VA, we have chaplains throughout the state, as well as community clergy. It's not so much where do you go, but go somewhere and have the discussion, reach out and let somebody know.
That's probably the biggest stigma in the military, is that we penalize people when they seek out help. From the top down, we encourage people to seek out help because we don't want to lose people. Suicide is a very permanent solution to a temporary problem.
Having been a senior leader in the military, I can absolutely say without any question that they will not be penalized.
The concern of the command is to protect the person and help them help themselves. So to get them into treatment and make sure that they're taking care of themselves to return to a level of healthy functioning. For some service members, that can seem at times to be a penalty because it can keep them from deploying, it can keep them from doing some missions that maybe they really would like to do, but it's really a protective factor.
If you have a broken leg, or if you have some sort of an illness, a medical illness, you won't be sent either. If you have dental problems, you won't be sent. And so people need to realize that this is just in a class the same as what as another medical problem is. We are interested, at the senior level, we are interested in saving people's lives. We do not want them to commit suicide because that is a permanent solution for a temporary problem. If you are yourself contemplating it as a military member, or if you as a member of a family see an individual who has experienced all those different signs of potential suicide, be sure that you ask the tough question, are you thinking of committing suicide, or of admitting the fact too that I am thinking of committing suicide, and taking yourself off to seek help.
Thought about my family and my brothers who are still in the fight in Afghanistan. What good would I be to them if I was dead?
It takes a lot of strength to be able to reach out and ask for help. Although a lot of people think it's a weakness, it takes a very strong person to reach out and admit that they can't handle things on their own.
If you see someone, and again, there's just a feeling that there's a change in behavior, start the conversation.
I started to open up to my girlfriend, my family, told them about everything that happened. And I thought they'd be ashamed of me for what I had to do. But instead, they were supportive. They even offered to go to therapy with me.
You know your family the best. You know your soldier the best. If you see changes in behavior, if you see the stressors that are starting to stack up, and you see them trying to self-medicate, then get them the help that they need. Don't just talk to them about the help, but get them the help that they need.
Now I know that I have hope. I look forward to seeing my children grow up and, if need be, going to serve my country again. There are days when I see the dark clouds gathering, but now I know I have support to see me through it.
So often when I talk to people who have attempted suicide, the one thing that they say over and over is, I really wanted somebody to ask me the question. I wanted somebody to reach out and show that they cared. So we really have to step up to the plate and be that person that asks, and be that person that maybe it sounds a little funny and you don't want to embarrass the other person, but I think I'd rather ask the question to a friend or a family member and be a little embarrassed when they say no than to have to live with not asking.
I've talked with many people who are survivors of a person who has committed suicide, and almost to a person, they always say, if only we could have done something to have stopped that suicide. It is a question that is a tragic question, and it haunts an individual. And again, be sure to always ask the tough question, are you thinking of committing suicide?
One of the risk factors for suicide we have heard about is depression. Not all individuals with depression are suicidal. However, 90% of those who die by suicide had a diagnosed mental illness or would have been diagnosed, most commonly with depression. Other risk factors include substance abuse, family history of suicide, hopelessness, impulsiveness, or aggressive behavior, barriers to receiving needed treatment, financial, social, work, or relationship loss, physical illness, and lack of connectedness. Warning signs include talking about wanting to die, talking about hopelessness or having no purpose, acting anxious or reckless, sleeping too much or too little, withdrawing or feeling isolated, uncontrolled anger, and dramatic mood changes. I am Dr. Dave Myers. If you are concerned about somebody, ask a question, save a life.
It's okay to ask the person if they have thoughts of hurting themselves.
Get help for mental, physical, and substance abuse disorders.
If you know of someone who may be suicidal, restricting access to lethal methods of suicide like firearms is extremely important.
Pay attention to the warning signs of depression.
Connected us to family, to the community, and to friends saves lives.
Suicide is a permanent solution to a temporary problem.
If you ever feel like you need to talk to somebody,
if you're feeling suicidal,
don't be afraid to ask for help.
Asking for help is a sign of strength.
Please call the U.S. National Suicide Prevention Hotline.
1-800-273-TALK.
Or visit your nearest emergency room.
Ask a question, save a life.
Ask a question, save a life.
Ask a question, save a life.